Okay, this is the continuance of the 137 nervous system lab review. So here are the brain pictures that'll be on the test. And this is a picture of a right, I'm going to step in front, a right hemisphere of the brain. So if you cut my brain in a mid-sagittal section, right down the center, if you remember our mid-sagittal sections, we're looking at the right side lateral view of that. So you're seeing the side of my brain there. Not mine, but someone's. But I've actually held this brain in my hand. I always tell this funny story. I'll tell it even though it's going to take up space, but you know, never mind. I don't have time for it. I'll tell you later. All right, this is the brain. What we're looking at here is the upper part of the brain. There's four portions of the brain: the cerebrum, the diencephalon, the brainstem, and the cerebellum. What we're looking at primarily here is the cerebrum, although we do see, I'm going to go ahead and label this. This is the cerebellum here. This looks almost like a bunch of noodles that are draped on top of themselves, and this almost looks like the pages of a book. So this is the cerebellum, and again, I'll give you that chart on Blackboard that shows you some of the things that these areas control. Now, we figure out the different lobes of the brain, and these will sound familiar to you because we talked about the frontal bone, the parietal bone, the occipital bone, and the temporal bone. We have the same name for the lobes, and we name those based on certain, we have a lot of hills and valleys. These little humps you see are hills here. We call them a gyrus. And then you'll have a big depression, which you may not be able to see, but these are called a sulcus. So we just divide these up based on where we see those major sulci. Right here is probably the what we call the central sulcus, which is a major depression in the brain. But from about this region here is the frontal lobe. Now, on the test, I'm not going to put an A like straddling the frontal and parietal lobe. I'm going to put it right up here and say name this lobe, and that's the frontal lobe. The parietal lobe would be from this central sulcus back in this area. So right around here we'll say, just for ease. So the parietal lobe, if I put an A here, this is the parietal lobe. The temporal lobe, I'm sorry, the occipital lobe rather, remember your occipital bone was in the back of the skull, is approximately in this area right here. And I would put the A back here at the extreme. This is the occipital lobe. And then your temporal lobe is everything that is left over, which is approximately right here. So right in there is the temporal lobe. I just didn't feel, you do have an atlas, or you have an atlas recommended, which should show you these, or you can look these up also on the internet. But I just wanted you to give you my version of these. So let's go to the next picture. Now, this is not the one I wanted. Let's go back here. Now what this is looking at the, again, I'm going to step in front here. If you take this section of my brain skull off, this again is a right hemisphere we're looking at. You're looking at the medial side of that. And again, it's a right hemisphere, mid-sagittal section. So everything up here, we just showed you what I wanted you to know about that on the other diagram. This is the cerebrum. So I'm going to show you a few things right here, very pared down. We have this would be more white looking. In fact, on your diagrams on the Blackboard, I think I have 3 pictures on there. The first 3 pictures on those diagrams for nervous system are of a sheep brain, which are not going to be on your test, but I put those on there because you'll see that the structures like this in that sheep brain and in here are extremely white looking compared to the rest of it. It actually all looks brown, I know, but this is a preserved brain. In a living person, it would be more white, and that sheep brain was a little fresher, so to speak. So you can see how white that would be. But this is a big band of white matter that kind of connects your hemispheres. This is called the corpus callosum. This is on your list. You can look up your list. Let me just go through on this diagram showing you the 4 major parts of the brain, which are not going to be asked on this test. But your cerebrum is up here. Your diencephalon is essentially right in here. It's kind of not a hard and fast rule. That's why I will not ask you that. Your brainstem is right here. just right in here. Here's your cerebellum. That's the four major parts of the brain. What I'll need you to know here, you can go ahead and list this as cerebellum. This is a cross section, and you can see what almost looks like a tree. That's actually called the arbor vitae, which means the tree of life. But it's a band. You can see that that's whiter looking. That's white matter on the inside of the brain, we said. Gray matter is on the outside. So this is the cerebellum. This region here is the midbrain. If I put an A right there, that's the midbrain. This is part of the brainstem. There's three parts of the brainstem: the midbrain, the pons, and the pons has this very big goose egg. Hardly no one misses the pons because it's a big goose egg right there. Pons means bridge. You'll see that on your chart I give you. And that says a lot about what the pons does, actually. This is the medulla. Why? Because my mama says it is, right? Some of you will get that joke if you've watched The Waterboy. But this section right here is the medulla oblongata. From there down, where it comes to a point, from about here down, that is your first part of your spinal cord. Obviously, they've cut it off, but this section is your spinal cord, so you can label that. Anything else I put on there? There's one other thing. In the diencephalon area, we actually separate that into three regions, which you also do not have to know for this lab exam. But we have an epithalamus, a thalamus, and a hypothalamus. There's one thing I wanted to show you, and there's a little bean right there. It looks like a little bean, maybe like a little kidney bean or something. And that is the pineal gland. And that is actually, we've talked about that, I think, before we had to go online. This is where you produce serotonin and melatonin. Again, serotonin makes you sleep. All right, there's one more picture I want to show you, and it's the same view, but it's blown up for you. So, I'm not going to ask you cerebellum here because it's cut off. I'm not going to ask you spinal cord, it's cut off. But some of these other structures you can see a little larger. There's the corpus callosum. There you can see the bean a lot better, I'm sure. That's the pineal gland or pineal body. This is the midbrain, the pons, medulla. And that's really all you need to know on that one. So we're going to cut that off now. That's a review of the muscular. Remember the muscles, you're going to know each one of the muscles that is listed. You will have to label that potentially on one of those diagrams I gave you. On the nervous system, hopefully we went through and showed you what we needed you to know. I'm sorry, I'm not done. I'm going to show you the nervous physiology real quick. So that's the second part of our nervous lab. I apologize for that. So let me see if I can get here a little quicker. Hopefully I can find this. Bear with me here. Okay, I'm not used to this in this format, so let's see where it's at here. Sorry, this is taking a little time, but okay, I think it should be right up here. Okay, bear with me for a moment. I'm not finding this. I'm going to start over here for a second. All right, here we go. Nervous system physiology. Okay, the first part of this begins with the cranial nerve discussion, and this is you have two ways to approach these. On the lecture test, you'll actually hear a train going by. We live close to a train track and also close to an airport. But in the lecture notes, you will see that the cranial nerves have a function, and that will be on your lecture exam, and that will be those should be very easy because I'm going to give you a very quick function. In fact, I'll do that here in the midst of this. What we do in the lab is we figure out a way to test for that function to see if that nerve is working. And again, these are bilateral. If you look at the underside of the brain, the cranial nerves start from the underside of the front of the brain and go back toward the back, and there are 12 pairs of these. There's one on each side. So in other words, you can have a function lost on either the right side or the left side. So let's start this. The olfactory nerve, cranial nerve 1, the function is a sense of smell, period. That's all you'll need to know in the lecture. How do we test that? Well, we put something aromatic out into the air and see if someone can smell it. Generally by blocking one nostril and breathing into either the right or left nostril. And they may not be able to pinpoint exactly what the smell is, but as long as they can smell it. Cranial nerve 2, this is for vision. That is your function. That will help you in the lecture part. That's what you'll match it with on the test. Here we can do this a couple ways. You can go to an optometrist, of course, and they can check your vision. Much better than what we're going to say here. Or you can use the old Snellen eye chart and go 20 feet away and cover one eye and check the vision in each eye. We did this when we were in school with the school nurse. 20/20 actually means that you can see at 20 feet what the average person can see at 20 feet. If you have 20/10 vision, that means you can see at 20 feet what the average person can see at 10 feet, and vice versa. If you have 2200, you can see at 20 feet what the average person can see at 200, which means you have very poor vision. All right, cranial nerve 3, the oculomotor. There's a couple ways to test this. You can shine a pin into someone's eyeball, and that eyeball, that pupil, which the pupil is the hole in the eye, we talked about that in chapter 12, or we'll talk about that next semester in chapter 12. It will constrict, it will get smaller, contract, some people call it, but it gets smaller. The other eye will actually do the same thing, even though you're not shining the light in there, because it's a reflex. If you don't want to go out in the sun and cover one eye and scream and say, oh, the sun is bright. So it's a reflex to protect you on both eyes, but that is the responsibility of cranial nerve 3. Another way you check cranial nerve 3 is with, and also cranial nerve 4 and 5, the trochlear and abducens, is to take your finger, I'm going to put my finger up here somewhere, and you tell the patient to follow your finger, and you draw a Z pattern, and if you watch my eyes, I'm following it, and you draw an H pattern without them moving the head, and you watch the eyes, how they track that. These all move the eyeball. That is their function. Trigeminal, number 5. This is what is known as a mixed nerve. It has two different functions, a sensory and a motor component. It is sensory to the face. So you can take a Q-tip or something and I'll put your pan out here a minute. We'll pan out. I'm going to say this is a Q-tip, but you can have the patient close their eyes and you can rub this here and say, do you feel that? Do you feel it? Do you feel it? The name trigeminal means 3 twins. You have 2 nerves with 3 parts. An ophthalmic, a maxillary, and a mandibular division. You go to the dentist, they're going to numb one of those likely. So you can check that part of it by stroking this with a Q-tip, each side. Again, hopefully there's no problem, but you can have a problem on one side. The motor part of this is to have them open and close their mouth. That is chewing, and that is a function of the trigeminal nerve. If their jaw juts to the side, or only one side is functioning, then you have a problem with the other side. Facial nerve also has 2 parts. It is a mixed nerve. The first part, it is motor to the face. Are you still panned out? Okay. It is motor to the face, so you have the patient smile. So the muscles of facial expression. It is sensory to the tongue, to the anterior 2/3 of the tongue. So we would test that by putting some taste, either sour, sweet, sour, sweet, or salty on the anterior 2/3 of the tongue and see if they can taste it. Another way to test it. Cranial nerve 8. I usually do this as a demo in the class, but since we don't have a lot of time here. Vestibulocochlear, number 8, has 2 branches, a vestibular branch and a cochlear branch. The vestibular branch, you should be able to check them by just visualization. It is for balance and equilibrium. So if they're staggering into your office, then they have a problem with their balance. The cochlear branch, you can actually stand behind them, maybe, and do some kind of noise and go away from them, or you can stand 20 feet away and say, hey you, can you hear me? Do a forced whisper, and that's a way to check that. So balance and equilibrium, hearing is the actual functions. Cranial nerve 9 and 10 are often checked together. You probably had this, the unfortunate thing where your doctor sticks the tongue depressor down and says ah, and they watch your uvula rise, the little speed bag, and it should rise right straight up the middle. It shouldn't deflect either way. If it does, you have a problem in one of these nerves. And then they will stick it down your throat to check your gag reflex, which is also a function of these nerves. The vagus nerve, we say its function is parasympathetic supply to the body. It is the major parasympathetic supply to the body. Remember that for your lecture test. Glossopharyngeal, again, we say, I just say is motor to the throat, and it is also checks the taste on the posterior 1/3 of the tongue. Spinal accessory nerve, you know this just as accessory nerve now. I learned it as spinal accessory. It is motor to the trapezius muscle and the sternocleidomastoid. So you can have someone shrug the shoulders while you resist it. Are you still paying out? Mm-hmm. You shrug the shoulders against resistance, and if they can only force one shoulder up, or this shoulder, they have a problem in one of those nerves. So this actually is helping the spinal nerves. It's an accessory because most of your muscles are controlled by spinal nerves, not cranial nerves. Lastly, the hypoglossal nerve, cranial nerve 12, is motor to the tongue. Have them stick your tongue out. That's how you test it, but it's motor to the tongue. If they stick their tongue out to one side and they're not being goofy, what you will see is on the other side, if I stick it out to the left, for example, on the right side of my tongue, I will have little furrows where the tongue is drawing up. It's a muscle, so it is atrophying, and that's a sign of hypoglossal problems. Okay, the last part of this, I'm going to try to make this quick, and again, I would do this as a demo in the class. Everything you need to know for the test pretty much is in bold in this, and this is on Blackboard. I'm going to try to demonstrate this pretty quickly on myself here. Now, here's a stool. You've all had this done. And generally I bring somebody up in the class and we set them up on the front lab bench, and we will, this is my Reflex hammer, this is actually a tuning fork, but we're going to use it. And I would hit them there per se, and their leg will jump out, and then it'll relax. And you check this and it'll jump out and it'll relax. If those are the same, we say that is a 2+ a normal reflex. And it takes some time to get used to these and to learn how to do them and to grade them. But what if I do this and they have that reflex, and I do this over here and they have that reflex? I would grade that as a 2+ on the right and a 1+ hyperreflexia on the left, meaning it was decreased. Well, if they have hyperreflexia, what does that mean? Hyperreflexia means we have a lower motor neuron lesion. What that means is you have a neuron coming from the brain to the cord, and then one from the cord out to that structure, to that muscle in this case. That tells you that the one going from the cord and out to the structure, there's something wrong with it. And what can cause that? A disc herniation, pressing against that nerve. Or someone has had polio when they were in their youth. Okay, another thing. How about if we check this one? It seems normal. And this one, it's like, boom, like they're kicking a 70-yard field goal. That is known as hyperreflexia. I would grade that as a 3+, possibly a 4+, because sometimes they can go boom, and then their leg will keep going. And that's called clonus. It will keep doing that. I've seen examples of these, both of these in my office. And that is a sign of an upper motor neuron lesion, meaning that the one coming from the brain down has a problem. So the one at the bottom is on its own. It's not getting any guidance. What can cause that? A stroke or MS. One other thing, and those are just 2 examples, but just note that. One other thing, if I check somebody's reflexes, and this is not uncommon, and you don't get anything. Some people just can't relax. You might have them clasp their hands together, and I always added to this, I would tell them to look away from me, so they didn't see me striking the tendon. And once I did that, usually I could get a reflex. When we do that, we would call it, if we got a normal, we call it 2+ with a capital R, meaning we had to reinforce it. It's called reinforcement, but that maneuver itself is called Jendrassic's maneuver. Okay, that's all I have. Hopefully we can get these loaded up in less than 16 hours, but you're going to have 2 parts to this. So Thank you, and I'll get the other review for the chapter out as soon as we can. Bye.